Good morning. Today we will be looking upon the key differences between benign and malignant tumors. So, if I am to characterize the benign tumors are generally slow growing and they generally grow over a pattern of several months to over several years. The benign tumors can be lifelong as well as over 5 to 10 years. Now, if we talk about the borders, they are easily recognizable and they are generally well defined and encapsulated, meaning that they have a capsule around them. They aren't able to invade as aggressively as malignant tumors are, and thus have a very good prognosis compared to the malignant tumors. Similarly, they aren't able to metastasize. Metastasize means that they aren't able to spread to different areas or of the body. For example, a tumor which is of the brain will remain in the brain. It will not metastasize towards the lungs or other vital organs of the body. If we talk about histology, as I told before as well, that they are well differentiated, which means that they're conspicuous and each or every cell of them can be easily visible. Now, if we talk about the common types of benign tumors, they include adenomas. Adenomas are simply tumors of the glandular tissue. Here they're talking about the pituitary adenoma, which is about in the endocrine gland. Lipomas refer to the tumors of the adipose tissue. Fibromas or fibrous tissue. Hemangiomas are the tumors of blood vessels, and they're commonly present in small children. And leiomyomas. So finally, the leiomyomas are basically tumors of smooth muscles, which are present in the pregnant women as uterine fibroids, and they tend to bleed regularly, especially during menstruation. Now, when we come to the malignant tumors, they are the complete opposite of benign tumors, and they're extremely fast growing and they have an extremely poor prognosis. So, if they're able to metastasize, a person is more likely to die and has less chances of survival. They are they have it's very great chances of invading into the surrounding tissues. Now they have several characteristics and features which help them to invade into the surrounding tissue, such as a rich blood supply as well as nutrients. Now, opposite to benign tumors, they have an extremely poor histology and they are poorly differentiated. As I told you, the benign tumors are extremely well differentiated. Malignant tumors are poorly differentiated, which means that they are extremely difficult to recognize from electron microscopy. Now, we talk about the common types of malignant tumors. They include the carcinomas, adenocarcinoma, squamous cell carcinoma, and basal cell carcinoma. Basal cell carcinoma is the most common carcinoma. Similarly, we talk about the sarcomas. The sarcomas always revolve around the mesenchymal tissues of the bones and muscles. A few examples have been given: the osteosarcoma, which is predominant in teenagers, and rhabdomyosarcoma, which is in newborn babies. Now, leukemia is a cancerous basically disease of which frequently affects newborns and children. What happens in leukemia is that overall the level of white blood cells in the human body is lesser than 20%, and we know that white blood cells are essential in order to fight off the invading infection. Now, if we talk about the lymphomas, there are two types of lymphomas: Hodgkin and non-Hodgkin lymphoma. The non-Hodgkin lymphoma are more predominant generally, and these are the microscopic features which are given over here. Now, if we talk about the histological features or the microscopic features, benign tumors have a lesser mitotic activity naturally, as they tend to invade lesser, and they have well-formed stroma, and the nuclear features are more and more conspicuous. However, malignant tumors have an extremely high and rapid mitotic activity, and this is the reason why cancerous cells have various adaptations which help them to gather nutrients. And why a person dies in cancer is that a person doesn't have enough nutrients in order to satisfy all the cells in the body. And the malignant cells basically they feed off the normal living cells. Now we talk about the diagnostic and prognostic factors. There are several diagnostic factors which include the histopathology, immunohistochemistry, the genetic analysis, as well as the chromosomal analysis. Now we talk about the treatment approaches. There are several different treatment approaches. Benign tumors can be just left on themselves because they aren't dangerous, or they can be surgically removed if they offer basically cosmetic effect. However, malignant tumors, on the other hand, they have to be removed by a variety of options. If they are In the first stage, they can be easily removed by radiotherapy or chemotherapy. However, in T4 or T3 at a later stage, the only chance of survival is to remove the malignant tumor involving invasive surgeries, which are extremely intensive. Thank you. I hope the difference between malignant and benign tumors was clear to you. Thank you.